And subsequently, as later on in 2021, we were able to get some vaccinations which were approved by the FDA for COVID-19. And here is a list of those vaccines which were approved: for the Pfizer vaccine, the Moderna vaccine, and the J&J or Johnson & Johnson vaccine. The Pfizer and Moderna have most largely been used in the U.S., also with J&J. The Pfizer and Moderna are both messenger RNA vaccines. Initially were given with 2 shots 21 days apart for Pfizer and 2 shots 28 days apart for Moderna. And the J&J was a 1-shot vaccine, which was a viral type of vaccine. The effectiveness against COVID-19 after 2 shots for Pfizer was about 95%, similar for Moderna. J&J was found to be a little less effective with a single shot. But all of these essentially, were effective against death from COVID-19. And this was obviously being studied in the general population at the time. And so as the COVID-19 vaccines came out, we established a COVID-19 and vaccination clinical trials working group. And again, I had the privilege to be part of this, and we established some guidelines for cancer patients for COVID-19 vaccinations. For those patients in phase 1 trials and phase 2 and phase 3 trials, obviously the recommendation was that the vaccines should be given on vaccine availability, but the timing based on mechanism of action for the phase 2 and phase 3 trials. For the phase 1 trials, most investigational agents, the timing of the vaccination again should be mechanism based. And then depending on whether it's immunotherapy or a dose escalation, including TKIs, there were different vaccine schedules and discussions with the treating providers that we had recommended. In terms of vaccination with type of treatment, for surgical clinical trials or for surgery, the administration at discharge after recovery from postoperative complications was generally recommended. In terms of solid tumors or cancers, which are other than blood cancers, blood type of cancers, so such as cancers like breast cancer, lung cancer, prostate cancer, or colorectal cancer. We also recommended a vaccine on availability for most cases, except for patients who were on cytotoxic chemotherapies, where 1 to 2 weeks before or 1 to 2 weeks after the drug dose would be recommended because of the possible for myelosuppression to increase the potential for immune system to mount a response. In terms of patients who had blood cancers or hematological malignancies, again, those receiving intensive cytotoxic chemotherapies, the recommendation is to delay until the recovery of the neutrophil counts. But most other type of treatment options, patients can get vaccines on availability. Special scenario is hematopoietic stem cell transplant, as well as adoptive cell therapies such as CAR T cells, where the vaccinations are generally recommended more than 3 months out from the treatment or the transplant.